Hi, Dr. Mark King from the Motion Palpation Institute. I'm here to talk a little bit about Achilles tendinopathy, Achilles tendinosis, Achilles tendinitis, different stages of the lesion. Have different names. Obviously, the itis is the acute inflammatory state, and then the opathy or osis is more the degenerative part. But from a diagnostic standpoint, which part of the tendon is affected is one question you need to ask. You need to rule out retrocalcaneal bursitis, which is not common, but it can be in there. Is there joint dysfunction? Obviously. How are the foot intrinsic strength? How's the foot intrinsic strength? Like Dr. Misha talks about a wink sign. You could do the toe differentiation like they do at DNS. Is there any thickening and tenderness along the tendon? You obviously have to rule out a tear, and you can do that with that gastroc squeeze. And then you can obviously in the history find out, is there a specific injury, or was it more of a slow degeneration as they went along? Now, from a treatment standpoint, obviously we want to make sure the foot gets adjusted if it is a stiff foot, has joint dysfunction. And from a rehab standpoint, we have to activate the intrinsic muscles of the foot. So I'm biased. I like what Tom Michaud does. I like what DNS does. Dr. Michaud uses the Toe Pro, and you can go on his Human Locomotion website and learn more about that, but that helps activate the toe flexors. DNS obviously gets the foot intrinsics going. So some of the other treatments people use are dry needling, radial pulse or radial pressure wave, also called shock wave. The soft tissue treatment is a big deal, whether you use myofascial release, ART, Graston factor, any of those can be helpful from a soft tissue standpoint. Need to look at the shoes. Shoes are very individualized, and it's a long topic, but that bigger toe box is important, not the super rigid shoes typically, but shoes become very individualized. And with any of these tendon problems, you need to make sure they're on an anti-inflammatory diet and supplements. So that's just a quick recap about Achilles problems, and I hope that's helpful. Thank you.